How's it going, guys? So we got a special guest, a surfer all from Puerto Rico. All right. So, clue us in. What brings you from there?
I have been recurring back glute, L4, L5, maybe more issues from a lot of wear and tear. I'm 40 years old. A lot of activities for many, many decades, and it's just the pain is getting so recurrent that it's keeping me from being able to have the active lifestyle I'm used to. So I was looking to meet you guys and do something different to see if I could provide a impulse of change.
Understood. And ever since this back problem's been going on, what kind of activities does it prevent you from doing these days?
Well, surfing for one is, I've come to a point where I'm thinking, I'm in my head now because I'm like, I don't want to get injured again. I've eliminated jiu-jitsu completely. Kite surfing, I've eliminated there's a lot of pull from here. I'm not playing tennis. I'm not playing golf. I've basically become a professional walker. All I do is walk, and I do some light swimming supported by a buoy. But that stuff makes me happy. But I come from a background of being way more active than that, so it's a struggle.
Understood. All right. Okay, so what other activities right now do you have trouble doing? Do you have any issues with the walking or standing?
Walking makes me feel good. If I walk too long, I get a few knots. Standing feels great. Driving is tricky. I'm using a pillow, like an air pillow, to soften the blow. And sitting is probably the most annoying one because I'm very focused on trying to keep a straight spine, but it's more of a mental thing. Like I have to constantly be like, oh no, straight. So sitting's gotten annoying.
So sitting is an issue. What about squatting or bending forward to pick stuff up?
Yeah, I'm not bending forward. I've eliminated all type of bending, and all I'm doing is hips back. So everything I reach, hips back. I'm a little concerned that I'm putting a lot of strain on my knees because it's a lot of squatting, but the alternative, which would be to bend, is out of the question. Like I know my body is trying to heal, so I'm trying to keep it together.
Understood. All right, let's go. Let's take a look, see what's going on.
All right.
Okay, let's take a look. So we're doing instrumentation right now, and we're looking for signs of inflammation. So when the structure of the body gets damaged, gives us some telltale signs. We're looking for, is there any swelling? Is there any edema? Muscle spasms that's like protecting and guarding the area. Is there also abnormal heat? That's one of the byproducts. So this device right here picks up abnormal temperature. We found one at this level. And it's no different from like going like here. See? We could feel with the back of my hand, and it feels warmer here versus the rest of the spine. However, since my hand is so wide, it's hard to isolate exactly what level, whereas this device, you can see this little tips over here is very, very narrow. It allows me to isolate, yep, it's at this particular level. That's what we need to take a closer look at. And it's just that level. See, now here's the interesting thing about it. Okay, the gentleman, he brought in MRIs, shows that he mentioned that it's off. Between a 4 and a 5, we see a smaller reading. The one down here has a little more bigger reading. So we're going to take a close look, see what's going on with these two. So first thing we're doing is we're just checking the area. We already saw during the instrumentation, I already did some visualization at the same time. So this is enlarged and swollen. I hope you can see on the angle from there. There's more muscle spasms. See this over here? This is flaccid, this is normal. This is getting a little bit taut. But here, see this? It's all tight here, all taut, all the muscle spasms. Much more tighter on this left side of here versus the right side. So clearly your body is protecting something in this region over here. Now we just got to take a look at the foundation itself. So first things first, what we do is there any edema in the area? Check all around the sacroiliac joints. How's this fellow over here? A little tight and discomfort?
Yeah, a little bit.
Right there, huh? So we have a little swelling and edema right there. It's not too big. Got some over there. How about this fellow over here?
This is alright. A little bit more.
Yeah, not too bad. Now we're gonna test it. We're gonna isolate it. Check it for PIAS misalignment. That's fixated over there. How's this one? Not too bad, huh?
Yeah.
This is moving. We're checking IN and EX. See, it's stuck, is not moving this way at all. See, it's pivoting IN and EX on the right. Not moving whatsoever on the left. Can't push it anterior. See, it goes posterior just fine. Now we're checking sacral segments. Yeah, got some swelling right here. All right. See, it's this one right here. There's 2S that's jammed up. See, and it sinks even more on the right side. Tender right there, sir?
A little bit, yeah.
How about this fella?
It's alright.
So it's this fella right here, 2S. Yeah. Let's check everything else. How's this fella here?
Yeah, it's tender.
That's the fourth lumbar. That's not moving too well either. All right, so we identify these two key areas. See, it's got one heck of a muscle spasm right there. Your body's trying to protect something. This left side over here. Yeah, that's not moving. See, you can touch your head to the left. See that?
Yeah.
It's not moving whatsoever to the right. All right, that's in trouble right there. So we tested referral on you. You see this gap over here? Right? That's a rudimentary sacral disc you got in there, that joint space in there. That's not normal. Considering at 40 years old, right, or firstborn, this is actually in 5 pieces, the sacrum, because we need to come out of mommy. And as we get older, this is the last bone that fuses to one bone. Typically around 27 to 32 years old, it will merge into one bone, just like all the other segments over here, unless you have some kind of trauma that knocked out of alignment, and as a result, that's why it never fused. Right. Now, if you take a closer look on the MRI that you brought over here, okay, this leads credence to what we're talking about. Now, you did mention, yes, okay, that 4th and 5th lumbar, right between here, that's a 4th lumbar disc, it is herniated. Now, what we also see here is that little 2S, the rudimentary space, like over here, and it may be a little hard to see because we're so small over here, we don't have a blow-up image on this one. But see that one? There's a little white speck inside that rudimentary 2S, right there. So right in that space between the 1S and 2S, that one little, the highlighted little white speck in there, that tells me, nope, that fella is wedged, gapped open like this. That's what we see in the x-ray over here as well. This fella is gapped open over here. And this one, it could help explain what you told us before during the consultation. You were experiencing hip pain, some inguinal groin pain as well, all right? Trouble sitting down a lot. That all correlates with this. After I correct this fellow over here, we may need to correct the 4th lumbar as well, because this is what normal is supposed to look like. See how much space we got here, the vertebral, the disc space on the vertical height on this one. You see that fellow over there? It's much more narrow. So this one we need to address without a doubt. And on top of that, we see over here, this fits cervical, that's not happy either. So this is what normal is supposed to look like. Well, relatively speaking, that is. We want to see something much more bigger than that fellow over here. So you can see what's different. All these, they're a lot more bigger space than that fellow over there. And we're not supposed to see this posterior osteophyte over here as well. See that little bulge over there? A little bulge in the front? We want to see nice rectangle shapes. Nice rectangle shape like this one over here. Nice beautiful shape over here, but we don't. This one got squished in. And that's what you told me before. You had that jiu-jitsu little fellow over there, right? And landed real hard on your neck, knocked that fella out. This bone got damaged and included a disc over here. This one we also need to correct as well, because we don't want that fella to basically rust anymore and cause more future problems down the road. All right, let's get rolling. Turn it on. Great job. Coming up, sir. Okay, walk around. Oh.
That was intense.
It is intense. So, close in. What's different?
I don't know. It just felt like I just hadn't felt that type of movement down there in a long time. Yet I'm still processing it, really.
Understood.
What is that down there? Is that this down here?
Correct. So I'm going to show it to you. Well, we just corrected on you. That's what you're explaining. In terms of that inguinal groin pain you're feeling, it's this fella. It's this fella over here. That's a 2S. So 1, 2, 3, 4, 5. It's this one over here that got knocked out of alignment. It went backwards. I had to push it real deep back in place. But you see over here, this 2S is connected to your right sacroiliac joint and your left sacroiliac joint. Turning it around with this joint space and this joint space. So there's no big surprise when you're feeling that referral groin pain, the inguinal region over there. So that's why we have to set this fella back in place. So pull this in. What other things do you notice that's different in your back right now?
Oh. I guess I feel like I'm not holding it. I feel like I'm always kind of holding myself. Feels a lot more relaxed.
More relaxed.
Yeah. I feel like it wants to fall, like it wants to go into its versus I feel like I'm always like.
Gotcha. So you're not clenching and tight as before? Let's take a look. Have a seat. Now, if you remember from the viewers, we talked about and showed the fellas that it was very tight, more so on the left side versus the right. And we see it already, the muscle spasms. Look at this fella. You feel that difference there, sir?
Yeah.
The muscle spasms has significantly decreased on the left-hand side. Look at that. Also calmed down quite a bit on the right-hand side too. So now we're going to retest, see what's going on over here. Look at that. So you have still a small little blip to the right. And see, that's a tiny little blip on the left hands too. So this is going to heal it just nicely. So let's take a look, see what's going on in that fellow. How's that fellow, sir?
Not bad.
See, your fifth lumbar, that's moving.
That one's
Right? See this one over here? That's not moving. That's a brick wall. See, it's not moving too well at all, sir. Yeah. That fourth lumbar, we do need to correct it after all. There you go. That's good. There's a beauty. Okay, walk around, sir.
feels good.
So close in. What's different in there?
Again, it's just like a release. There's like something, it's something's releasing. So obviously I don't know enough to know what it is, but it feels, my body's relaxing.
And that's great. Have a seat. Let's take another look. Hey, look at this. Feel that muscles over there?
Yeah, it's softened.
Yeah, see your erector spinae muscles, that's the postural muscles. Get a load of that. It's even looser, even more so. All right, let's take a look, see what's going on in there. And here's a story with degenerated discs. We may have to tilt the scope to get a proper reading on that one, because they're not always evident, like this fellow over here. So he has like a very tiny little 1 point to the right, very subtle and slight on that fifth cervical. Walk around, sir.
I didn't even know I had it. I didn't even know that was that bad. So then you fix their, are you pushing it back in or?
That's right. We made a Gonstead cervical adjustment to that. We pushed the bone forward because, I'll show you in a moment, these are the lumbar nerves, is a model of the lumbar spine, but the cervical is just very similar, just slightly smaller, right? I also want to let the viewers know, this is how big the nerves are for your lumbar spine. Why? Because it needs to run your legs, the sexual organs, the bladder, the colon, so on and so forth. That's why it's this big, right? You don't need a microscope, this is the actual size. They're huge. Now, the problem is, when you have experience of trauma, it knocks the bone backwards like this. See what happens to that tunnel? It starts collapsing. And in your case, the cervicals, it not only backwards like this, but it did this as well. So look what happened to that tunnel right there. It collapsed even more. So it started decreasing the nerve function down to your shoulders, down to your elbows, the wrist, and whatever this nerve is connected to. So in the fifth cervical, that's where the phrenic nerve is. That goes all the way down to your diaphragm, your lungs, other innervations, such as over here. Right. From this region over here, as we mentioned before, it's going to innervate muscles that deals with shoulders, glenohumeral, the elbows, the wrists, the fingers, and also on top of that, the lungs over here as well. Right? So that's where the phrenic nerve comes from, all the way straight down to the diaphragm, right? And also lungs itself. So that's a way to start restoring it. And now, pull this in. How's that neck doing? What's different about it?
I'm afraid to ruin it. Like it feels better. I'm afraid now, I'm just afraid I don't want to move around too much because I don't want to undo what you just did. So what do I do?
No, don't worry about it, okay? I don't want you to have a fear or concern that, hey, whoa, I'm in great shape, I don't want to, knock it out again, I don't want to do anything. No. I don't want you to hold your life over this, right? This is a progressive procedure over here. We're going to continually correct the structures until your body's able to be nice and strong to stabilize it. So what can we do in terms of your pelvis? Well, even though you may look like a great physique, and especially as a professional surfer, goes without saying, yeah, you built a lot of your core because you got to balance on that surfboard, right? What I want you to focus more on is your lower core, all right? Yeah. Exactly. So in other words, what you see in the gym, those guys with the beautiful V shape on the bottom, that's what you got to get. Not the six-pack abs, the V shape, right? That's the lower core.
Yeah. Okay.
So that's what we need to structure up a lot more. Okay. In terms of the neck, the key aspect is, even though, yes, I understand, you run a lot of things as well, right? All the other aspects you're doing in your life. Try to keep your cell phone or your papers, everything else in eye level, right? What we don't want to do is look down like this, and you see significant strain we got over here. Yeah. That's not helping that neck either. Another thing is also when you sleep on a pillow, do you sleep on your side or on your back?
All of them. Side, back, I switch around.
Okay. Well, the key tip for the viewers, whatever you do not sleep on your belly. That's the worst position on the bone. Right? Now, in your case, I would recommend either you sleep on your side, but if you sleep on your side, please get a pillow that fills up the space between the mattress, your shoulder, and to the head. What I don't want to see is where the pillow, if it's too short, your head tilts this way. No good. If it's too big, Your head's going to tilt the other direction. Also no good. You want it in neutral position. But the more ideal position for you to heal up that cervical disc is actually on your back and without a pillow. But right now, that might be a challenge to do so. It may be uncomfortable.
Okay.
So I want to have a thin pillow as possible, something like 1.5 to 2 inches thick.
Oh, okay.
All right. One particular brand, and actually it's quite economical. Actually, it's called I believe it's Certa Posture.
Yeah, I've seen.
Right, the Certa brand. They have a pillow, okay, but it's with the 1.5 inch cassette.
Okay.
Right. So
and it's got does the pillow have a groove?
No, it's not a groove. It's actually a very thin pillow.
Okay.
All right, and you gotta wait for it to flatten out a little bit, so that when you sleep on it, it's not too thick. Because if you have a very thick pillow, it's gonna push your neck very forward. It's gonna cause more damage in there. But if you have a thin pillow, it's not gonna push you too forward, right? So that's give you a little comfort until one day, and that's what I do. I sleep with no pillow on my back whatsoever.
Wow.
So that's why when I sleep on the mattress, I'm in neutral position. So I try to preserve the discs in my neck there. Same thing in your case as well. That's going to take some time to regenerate. Can it regenerate? Yes, because it has not passed the point of no return. However, you're going to do activities that will not aggravate it any further.
Okay.
All right? That's it. That's all we think about.
That's
Anything
awesome.
else, sir?
No, I appreciate it.
Any other time? Have a safe flight back to Puerto Rico, sir.
Okay, man.
You're welcome.